Hello viewers, welcome to the Free Press Journal. I am Sneha Biswas and today I am at Marine Drive. We are here to support a cause, cervical cancer. Cervical cancer is the 6th most common cancer in the Eastern Mediterranean region. It had claimed a lot of lives, including the most recent one being the death of Dolly Sohi, the television actress. Today we are supporting a cause. We are supporting a drive that aims to create awareness about cervical cancer. The Rotary Club Bombay Pier, it actually aims to spread awareness about the cervical cancer, and they have actually organized a fun drive at Marine Drive, and they would be covering several areas in the Bombay region to spread awareness. Mayuri, why have you come up with this initiative? What made you come up with this?
So I felt that when we vaccinate our daughters, when they are going abroad, a lot of our children, the cost of this vaccine is really expensive. And I realized that the marginalized society does not get access to this, and they are at a higher risk than our kids too. So therefore we decided that there is something that has to be done to prevent this, because cervical cancer is very preventable, and if we give this vaccination to them, then surely we'll be able to give them a kickstart to a healthier life, which they are entitled to. It's just that they are not able to. So that's what Rotary Club is planning to do.
Okay, so I would like to understand that which all areas the drive is going to cover.
This drive will cover from here we will move towards Cuff Parade, Colaba, because that's where we will be starting our vaccination drive in the slums of Colaba and Cuff Parade, because the corporator there is very cooperative. We plan to take it to the other slums in Mumbai as well.
Sir, do you think that more political parties should come forward and support such causes?
I think politicians must support issues like healthcare and education. These are issues that ultimately affect the people more than the issues sometimes we talk about as politicians, as media, in the public discourse. And I've always believed that the most basic issues, education, healthcare, these are the most critical issues in Mumbai, in Maharashtra and in India. So I've always supported these issues. I've always tried to raise these issues, and I'm glad when organizations, NGOs, politicians, private sector come together to solve these issues. I think it's a good start.
So right now we have Dr. Anjana Senani with us. Welcome, ma'am. I would want you to shed light on the matter that people who are actually diagnosed with cervical cancer, should they panic?
Being a medical oncologist, I cannot say one should be panicking, because we have a lot of treatment, and the whole purpose of awareness is that we catch it at an early stage. So obviously patients who are at a pre-cancerous stage or early stage can definitely be cured of cervical cancer. So that's the whole purpose of awareness, wherein just a simple biopsy or excision at a better clearance of the cancer locally only completes their treatment. And if at all it is little more advanced, which has gone beyond cervical region, then one can undergo radiotherapy along with surgery, and sometimes we combine chemotherapy. Just a little bit chemotherapy to allow the radiation to work better. So there is a lot of treatment, and for advanced stages also one should not be panicking, because we have very modern therapies nowadays. We have monoclonal antibodies and immunotherapy for cervical cancer, which are advanced.
Okay, so since prevention is always better than cure, so what is the right age to get vaccinated? Since we have vaccines available for this, what do you think? What is the right age?
Yeah, since the major risk factor for cervical cancer is promiscuity, having multiple sexual partners, having a very high sexual activity, unprotected sex and all. So definitely the target group is always 9 to 12 age group, which is assumed to be a pre-sexual activity group. So that's why the vaccination is ideally for 9 to 12 age group. And suppose somebody has not received vaccination during that time, it doesn't mean that they cannot receive vaccine. It is just that the schedule changes for them.
Poonam Pandey matter. You've seen what she did. Do you think it is right to make an issue of such a sensitive topic?
You know, at this point, I don't want to have a conversation on something that's controversial and something that is not appreciated, because we are really here collecting in a very positive way to take a step forward. This is not a fake cause, it's a real reason.
Is it possible somewhere near that these vaccines will be available free for the people who actually can't afford them?
I think government has already rolled out a plan for the free vaccination. Just we have the polio drive, we have taken the polio drop drive, the same drive the government will take. And recently that announcement has come in the budget also. And from this year the government will start this program.
Right now we have Rajdeep Sardesai with us. Welcome, sir. So how do you feel joining this initiative on Sunday morning?
I think it's great that these initiatives are being taken because I think there is a huge need to increase awareness about cancer of all kinds, and therefore it's a pleasure to be here and see Rotarians with such enthusiasm come on a Sunday morning, and that groups like FPJ, Free Press Journal are supporting this initiative.
Sir, do you feel that media also plays an important role in this, and more people should come forward to support such causes?
Oh, absolutely. I think the media needs to invest much more time in health. It is the future of this country, health and education. You will never build a better India until you invest in health and education.
Comprehensive approach, we can definitely bridge the gap to beat cervical cancer. If you want more such videos, stay tuned to our channel. Till then, get informed, get screened and get vaccinated to beat cervical cancer.